I have to rotate it.
Hi friends, we are here today at my office here in Haworth, New Jersey, and I wanted to just share with you what I do and how I do it, one little piece of it, but it's a very important piece, and that is I do something called the Koren Specific Technique. I learned this, I guess, about 7 years ago, and I started learning it because after doing chiropractic for so many years, I was worried that my joints were going to start to get worn and torn, and I really love what I do, so I wanted to keep doing it. And I heard this technique was really exciting and very effective, and that I could even adjust myself. So I took the seminar, and I've taken so many since then. And one of the things, like a very key part of this technique, is something called the arthostim instrument, and that's what this is. This is an arthostim. It's basically a percussion instrument. It has different hertz, which are frequencies that it goes in and out, and you won't really know what I'm talking about unless you actually feel it. But what it does is it affects the nerve in a way that when we tap an area of your spine, then the bioreceptors pull that in, the mechanoreceptors pull that vibration in, and it actually moves the bone in a very gentle way. And that frequency is very accepted by our body because it's the same frequency as our nerve impulses work. So it's a very effective yet very gentle technique, and I even use it on animals. And they actually like it, but you have to kind of ease them into it, like dogs and cats. So basically, you know, even on babies, it's fantastic because you can put as little or as much pressure, and it's just this, look how tiny this head is. So if it's a little baby spine, then it would be perfect for this bare head, and you can push as hard or as light as you want. And I always like to do the lighter pressure, but if you push harder, then you'll get more of a intense change. But what I found is that less is more with people. So you think harder is better, but actually softer works better. So anyway, this one attachment, this one's it's called the double attachment, and that one's for like the spine, that where the two parts come out. I don't have a spine. Well, let me grab a spine really quick. Hang in there 1 sec. I want to show you how it works. Hello. So this double head, you can see, you would do it on these vertebrae, right? Or on the larger, this is your sacroiliac, this is your iliac, sacroiliac on sacrum. So that's what this one's for. It's a bit larger. And this is the single-headed attachment, and that works really great for any of like one-sided, or for skull, like putting it on the skull, or a little on the TMJ, or on nose. Okay, and then we got this large one, which I actually hardly ever use. I don't know. It's good for really large areas like the iliac bones. And then this is for children and babies. This is a mini double prong one. And really, children love this, and it's so gentle and so effective. And then, of course, we got the round one, which is, again, this one's really good for TMJs, for the jaw. And then if we're digging into maybe like the piriformis muscle, we can push in there. And then I love this one I call the squeegee. This one's amazing for the coccyx bone. All right. And for ribs, it's great for ribs because it covers like that. And sometimes I'll just do it along the scapula and like go underneath the scapula and just dig in there with this, and it feels wonderful. So if you're a chiropractor that's thinking about starting to do some instrument work, this is fantastic. I have a friend who's done activator, and he actually used this instead because he found it to be more comfortable and effective. But it's a fantastic instrument. But again, there are so many different techniques that you can use this with. It's made by Impact and Koren Specific Technique, or KST. It's definitely necessary with that technique, and I love KST. So if you want more information about that, Koren Specific Technique, you can check out our website, but that's fantastic. So let me ask my video producer, is this enough information, or should we do one more instrument? Let's do one more instrument that I love to use in my office, but trust me that we have lots of fun and exciting technology here. So this is also made by Impact. It's called a Vibracusser. It's amazing. It has a small head, but it has in and out also, that same percussion type motion. You can hear it. When I adjust children, they're like, ah, they love to like make the sound, ah, you can hear that. It's great. It breaks up congestion in the lungs if someone's got some, fluid buildup or asthma type stuff. This is fantastic. This as well has a ton of different heads. I'll just show you. It's got this. This is like this is a scraping tool, so I like to use this on like the TFL, like that tight band that goes along the leg. This is more of a round head that, see, these just basically, you can just unscrew this and add that. So if you're just a person that's looking to get an instrument to help you with some massage, this is a very expensive instrument. This is more professional grade. I wouldn't recommend this unless you have money to burn, because it's a lot of money. So anyway, these are all the different heads that you, this isn't a head. This is one of the heads as well that you can put on. And then there's like a little pointy thing where you can get trigger points in there. So what I typically do is when a person first comes in, I will just go up and down the spine and up and down the before the adjustment. So I get the blood flow going, I get the muscles kind of relaxed and just kind of activate the body, and then we go in for the adjustment. And it's wonderful. Somebody way back in the day, an old school chiropractor, taught me about doing just a minute or two massage before the adjustment with some kind of a massage technology, and out of like far and wide, this is the best I've found. So if you're thinking of making an investment in your practice, I highly recommend this if you're a chiropractor. And I'm not making money off of this, I just love what I do and I want to share the message. One more thing I do, and I've been doing this for years, I started when my kids were little, was essential oils. And when a patient lays on their back, I think touch is very important. We are designed to touch each other as humans. And, if you're a healer like I am, we have a healing energy flowing through our bodies. So touch is important. And since I'm using instrument, I always like to touch the patient as well. So I make up a blend of essential oils, and I put it in here with some coconut oil, some unfractionated coconut oil, which means it stays in liquid form. And then I add these beautiful doTERRA oils like Deep Blue, which is great for muscles and achiness. It's a blend. I'll use some frankincense if I am so inclined, and that's really calming to the body. I'll use some lavender, some peppermint, some eucalyptus, and sometimes I'll use a tree oil just to ground the patient. But I have these blends pre-made. It's always different, and I love hearing the patients say, oh, that feels so good. In addition to that, the essential oils are antibacterial and many are antiviral. So by using the essential oils, we're actually killing the bad germs, and we're also helping enhance the healing process and relax the patient. So those are just a few of the things I do on a regular basis on every adjustment. But I'm going to do another video to just show you the things I do when a patient's in a lot of pain, and that doesn't happen all the time, but sometimes when a person first starts coming, they'll be in pain, or maybe they'll have an accident or a flare-up while they're coming in. So we'll do that on the next video, but I hope you enjoyed that. Thanks for listening, and if you have any questions, just shoot me a text on my messenger account, Victoria Dubin Master. Thanks. Bye.